Well, in our practice, we basically have three different options you can get. We have the ultrasound radio frequency, which we've been doing for about 2.5 years. And they come out of California. And what they do is provide the ultrasound and the radio frequency. Ultrasound for breaking down the fat removed from the body through the natural biological process, and also the radio frequency, which tones and tightens the skin, but also helps break down the fat and eliminate from the body. Our second machine that we have to offer is the lipo laser, and that includes a lipo laser and the far infrared heat along with that. It's got 6 paddles with 9 Mitsubishi diodes on each paddle, and we got 4 small paddles for the lymphatics. This machine we've been using for about a year now. We're getting phenomenal results with it. Primarily the areas that we use these machines on are the face, arms, thighs, inner and outer thighs, posterior and anterior thighs, and also the stomach and love handles both posteriorly and anteriorly. The third line we have, we just started doing it, incorporates the radio frequency, ultrasound, and the lipo laser on one machine. So when the patient comes in, what they're getting is the lipo laser first, then the ultrasound care. We've just started doing that, and we're seeing some good results with that also. We've been doing 1 and 2, the radio frequency and the ultrasound and the lipo laser for about 2.5 years now. So what we're expanding into is just incorporating both of those into a second program. So we know we're going to get good results with those particular 3 programs that we offer. In addition, we also added several other things to our programs. After each core treatment, which is a radio frequency ultrasound, the lipo laser, or the lipo laser ultrasound combination, we're adding the regional body wrap using a product that's got a thermogenic effect and also a detoxification effect. Now you can use anything you want with this, so long as it has those properties. And the third thing that we're doing is we're incorporating the body vibration plate into the program. They're going to be on that for about 10 minutes, and they get that each time they come in. The protocol for this indicates that are going to be 6 visits for a protocol, which is the minimum protocols you can do for each one of these 3 different types of procedures that we have. Generally speaking, that is going to be based upon the body analysis that we do at the end of the consultation that we have, which goes into everything, including nutrition, food groups, weight loss, the whole 9 yards. And we do the body analysis, generally over 30% body fat, and most of our people do have that. Generally somewhere between 9 and 12 visits is going to be the norm. But 6 visits is the only thing that we offer as far as any type of advertising to do, because that is the minimum protocol for any one area. So we kind of keep it that. There's a few places out there that will offer 1, 3, and 6, or 1, 3, and 5 treatments. Well, we just don't do that. You see results, but not the maximum results that you can't see doing the minimum protocols and all the way up to 12. Now we do have patients that are doing more than 12 visits. Some of our patients are up around 40 to 45% body fat, and obviously they're going to need more visits. And we explain all that to them so they're aware of that. And we're getting phenomenal results at everybody. We put about 800 people through the program in the 2.5 years we've been doing this, and we're getting great results. We have our website at AltamontSpringsBodyContouring.com, and that has testimonials on it. We have testimonials here available for the doctors if they want to review them, and also on our Medlife, which is MedlifeBodyContouring.com. That would be the doctor's site. They can go there and look at all this. Our machines can be bought, they can be released, and we have a rental program now that we can offer the doctors in their office, or we have another program that we can actually come to the doctor's office if they're locally and do the test for them on a room rental or a contract type basis that we have put together. Yes, now when you purchase a machine, you will have access to a limited area that we're going to be offering. In other words, there'll be no other machines, depending on the size of the city, in your particular city. It's not really based upon zip codes, it's based upon the city size. Like Orlando, for instance, we have 3 machines in Orlando, that's all we're going to have. Now, Orlando Metro's got a little population of a little over 1 million patients, or 1 million people. And so we are limiting the machines to give the doctors a much more opportunity in exploring this and performing these services. Right now we use Groupon, we use Living Social, and local magazines that we advertise in. We're getting great response. Our program, if you buy the machines, is a complete turnkey operation. We offer everything, the manuals, the forms, all of the videos, and 1.5 days of training here in the Orlando office. Anybody in your office can use these machines, so long as you are on the premises, because they are doing physical therapy modalities in the form of ultrasound, and unless they're registered or certified CA in your particular state. Now, Florida, which I'm in, has a program where you can get a certified CA and they can do things without the doctor being in the office. But for the most part, I am here in the office 99.9% of the time when these tests are being performed. Right now we have 3 ultrasound machines and the radio frequency combination, and we have a 4th ultrasound radio frequency that is a smaller unit we use primarily for face. Our lipolasers, we have 1 of those units here, and in the process of getting 2 more. So our program is pretty comprehensive. The doctors don't have to do anything except come and train and start the program. We can have you up and running with these particular programs, particularly the purchase ones. We have financing available at very reasonable rates. In probably 2 to 4 weeks, we can have you up and running, depending on your schedule when you get down here for training. But we go through everything. When you leave our office, there's nothing you have to do except open your doors and start advertising and doing these particular therapies on patients. We're getting phenomenal results. We put, as I indicated earlier, almost 1,000 patients through the program, a little over, I think, somewhere between 800 and 900 patients. And we've got great results, not one complaint, and phenomenal results with everything we've been doing, both in the ultrasound radio frequency and the lipo laser machines.